In the aftermath of the Deepwater Horizon oil spill, impacts to bottlenose dolphins living in the northern Gulf of Mexico have been well documented. And these impacts include lung disease, adrenal gland compromise, and reproductive failure. We've been tracking these disease states, and reproductive failure is something that is not showing evidence of recovery. So our GoMRI project is focused on understanding the mechanism behind the reproductive failure rates and trying to look for evidence of recovery to see at what point are we going to start to see the animals bounce back and recover from the impact and whatever is specifically impacting their ability to successfully reproduce. The high rates of reproductive failure among dolphins in the northern Gulf of Mexico is alarming. So it is really important for us to understand the mechanisms by which this is occurring so that we can figure out ways to hopefully restore the animals and hopefully impact their ability to successfully reproduce. So we want to understand all of the factors that are impacting their ability and then see what it is that we can do to improve the situation or at least have our finger on the pulse of the problem and see, is it improving or is it staying the same or is it potentially even getting worse? We have a large collaborative team that's working on this problem, and we have really strong partners, which is why we're so excited about getting going with the project and seeing what it is that we can learn. So as part of this project, we're going to focus on live dolphins living in Barataria Bay, where we've already documented the reproductive failure rate is really high. We're going to work with the Navy dolphin population, which is a group of dolphins managed by the United States Navy, provided very good care, high-level care, and is sustained by an active breeding program. So we have the opportunity to focus on those dolphins, track pregnancies, and enhance the protocols we use to care for those animals. And then by just simply taking care of them and enhancing their care, apply those protocols to wild dolphins during health assessments of live dolphins in Barataria Bay, and use those protocols to help us further understand what is exactly going wrong in the different stages of reproduction that's leading to this high failure rate in the field. So that's part of the live dolphin side of it. In addition, once we have evaluated live dolphins, we're going to then track them with photo ID so that we can say, all right, we know this dolphin was pregnant, we diagnosed it in the field, and now we want to see, is she successfully reproducing? So teams will go out and monitor those females and document whether or not she had a successful calf. And then did that calf survive? So all of that will feed into the questions we have about what is actually currently happening today with those live dolphins in Barataria Bay. And then there's a pathology side of it too, where we're going to continue to explore and investigate the questions that we have with carcasses that are washing up on the shores along the Louisiana coastline, and compare those findings to findings from known cases. Again, going back to the Navy dolphin population, where they've had this rich history of a successful breeding program. So they do have cases that we can explore of successful and the occasional failed pregnancy that can really teach us about mechanisms of failure. So we can apply what we learned there, again, back to the wild dolphin carcasses to see if we can start to unravel what is really right now a mystery about why are these pregnancies failing and at such a high rate.